In the 1950s, the first kind of HRT came on the market, which was Premarin, and that was derived from pregnant horses' urine. It was so amazing that by the late 1900s, it was the #1 most prescribed medication in North America.
Karen Martel is going to help me and you navigate the ever-changing landscape of pre, peri, and post-menopause. Karen is a sought-after speaker and the host of a health podcast which has over 354 episodes titled The Hormone Solution with Karen Martel. She graduated from the Institute of Transformational Nutrition. She trained at the Nutrition Coach Institute and became a certified hormone specialist, also getting certifications for mastering the thyroid, mastering gut health. Every woman goes through menopause and over 80% suffer from debilitating symptoms.
And by the time you're in your early 40s, most women will have lost about 75% of their progesterone production. Progesterone has an incredible benefits for us. It's going to counterbalance estrogen. Estrogen's a growth hormone. It's by far the most important hormone for us women. It's what makes us women. Progesterone is...
Hi, my name is Chris Burris. I'm a longevity expert and the chief scientist at a lab focused on a longevity molecule. My primary focus is to help people live longer and better lives with science. Make sure to subscribe and share so you and your friends can live longer and better. Well, actually, so you and your friends can live beyond the norms.
Hi, and welcome to the next episode of the Live Beyond the Norms Health and Longevity Podcast. The topic of this episode, menopause, is near and dear to my heart. Yes, I said menopause is a topic that is near and dear to my heart. This is because my wife is an influencer. She's actually has like 200,000 followers. She talks about menopause in Spanish. She is originally from Panama, and she shares all of her experiences going through perimenopause early and into menopause. Our next expert, Karen Martel, is going to help me and you navigate the ever-changing landscape of pre, peri, and post-menopause. In her journey to heal herself and to pass her knowledge to her customers, she graduated from the Institute of Transformational Nutrition. She trained at the Nutrition Coach Institute and became a certified hormone specialist, also getting certifications for mastering the thyroid, mastering gut health, which it turns out were modalities she was already using. Today, we want you, the female listener, to know, and we want the male listeners to realize so that they can better understand the journey their partners are on, 3 things, and I pulled these off of her website. Every woman goes through menopause and over 80% suffer from debilitating symptoms. Psychological symptoms are extremely common and not talked about enough. And then finally, natural hormone replacement is really safe. In fact, it is safer as it relates to cancer than excessive alcohol intake or being obese. And most importantly, there are solutions to help you. Karen is a sought-after speaker and the host of a health podcast which has over 354 episodes titled The Hormone Solution with Karen Martel. Karen, thank you so much for joining us today.
Well, I'm very happy to be here, Chris, and I'm glad that you're including the men in this because I will tell you, my husband just said to me the other day when he said something about, I said I was experiencing something, and he's like, is that the menopause? I was like, yes. And he's like, so like he's catching on. He's like, I'm so glad that you teach me about these things so I know what's happening in, like with you. And I'm like, yeah, I said, my guys don't know this. Men don't know this. And they should, because this is a decade usually of a woman's life. That's a long time, and it can drastically affect your relationships.
Yeah. So I highly recommend men stay tuned. We're going to be talking about some really interesting topics, and then really powerful solutions. So stick around. Now, Karen, you say that you have a passion for nutrition and hormones. Did you always know that you were going to end up in a health-related field? Can you look back at your childhood and see anything in hindsight that makes sense out of your current role as a health practitioner?
Yes, I was always interested in nutrition and health. And I actually started out in my early days when I was in my early 20s as a rolfer, which you may or may not have heard what that is, but it's a type of deep tissue body work. So I was into kind of holistic care at a very young age. And I was actually one of the youngest students to graduate from that institute. And then I practiced body work for about 20 years. And at the end, towards about the last 5 years of it, I started to feel in people's body when they were eating something that wasn't agreeing with them. And I could tell, because I was super into nutrition, and I was reading all the books about it, and I had my own issues and health problems. So I was diving into everything. And I started to feel when somebody was eating something that they were sensitive to because of the feel of the tissue. And I could say, you know what, you need to cut the gluten, or you need to cut the dairy, or whatever it was. And I could just tell, like, because they had this different feel to the tissue of the muscles. And I started to, like, I was counseling people as I'm working on their body, like, about nutrition. And then from there, I was like, oh, I just don't feel like anybody's going to pay to go see a nutritionist. And I couldn't get into it. And then I had my own hormone problems after having my first kid in my early 30s. And I'd had a history of all these hormone problems. I had endometriosis and ovarian cysts. And then I had my baby, and I started rapidly gaining weight, and I was doing everything right, like exercising, eating perfectly, trying every diet under the sun. And I was just getting fatter and fatter and fatter. I was having insomnia. I was having depression. I was having bloating and digestive issues. And I was finally like, what is going on? And I, went to the doctor. I was given antidepressants, sleeping pills. And I was finally like, I think this is hormonal. And I ended up finding out that, yes, it was hormonal. I had hypothyroidism. I had estrogen dominance. I had adrenal fatigue. I had all the things, all the hormonal things. And I decided, okay, I got to fix this. And I had been doing everything wrong. I'd been, calorie counting and working out like a crazy woman and doing all these things, when it was really about getting the hormones adjusted and in place. And then finally my body got back to normal. And I was like, I can't be the only person that's experiencing this, like where you're doing everything right and what everybody's telling you to do, and you're still gaining weight and you're still having health problems. And so I kind of from there was like, I think I need to do this. I think I need to get into this field of work. And so I did. I was on mat leave with my son, my second child, and I decided to just hop right in. And I did. And I went back to school while I was on mat leave. And from there, it was kind of like, it just exploded. It was like, obviously this is where I was supposed to be. And I ended up going into like an early menopause, probably similar to you said your wife did too, but I went into an early menopause. And so once again, I was shown, wow, I could be doing everything right. At that point, I was a nutritionist. I was helping women to lose weight. I was helping women with weight loss resistance and hormone problems. So I thought, oh, I'll sail through menopause. And then lo and behold, like in 6 months, I gained, 15 pounds, hot flashing, night sweats, losing my period, my sex drive, everything just went right out the door. And I'm like, once again, this shows you can do everything right and still have all of these things happen to you. And I feel like in this industry that you and I are in, we have this massive amount of women that are coming up going, I'm going to be fine, or I'm going to diet my way out of this, or I'm going to biohack my way out of this stage and nothing's going to happen to me. And then they hit perimenopause, and without changing anything, they gain the weight. They get like I did, they get the hot flashes, and they're like, okay, well, I better double down. I better fast more. I better exercise more. I better take more supplements. And so I'm here to just educate the modern woman, the healthy woman too, like the woman that thinks she's got it all together, into like, hey, when you lose your hormones, you lose them, and you can't biohack your way out of that. As simple as that.
First off, you're doing deep tissue body work, which I kind of just describe as you cause pain in people and then the pain feels better later.
Pain with purpose. Yes.
It's pain with a purpose. I like that.
Pain with purpose.
And then you realize you're very intuitive, right? So you're like, hey, like your muscles feel different. Like, what have you changed? And you're kind of consulting people on diets. Some of them probably thought you were crazy. Others are, just looking for solutions. So they're going to listen to you. And then you have your child, you go through all the hormonal adjustments that happen there, and like this rug is pulled out from under you, and that causes this transition. And then you go into perimenopause early, like that, like after you solved it all. That must have been extremely frustrating because, okay, one, I know my wife wasn't aware that she was in perimenopause, right? Like, all the signs are there. And if you were like reading and maybe even following somebody like her on Instagram, you would have known, oh, I have all of that. So did that kind of catch you off guard? Not just the hormone changes and the weight gain, but just like, hey, I didn't think I was supposed to be here at that point.
Oh, extremely. And it was, I was like, what is happening to me right now? Like, I hit it and I hit it hard. And there was things that preceded it that I now know why I went into early menopause. And so it's not natural, or not, I shouldn't say not natural, but it's not common for women to go into or start going into menopause at 42. Like it's usually 52. So I was like 10 years than the normal woman. So yeah. I knew that I knew enough about hormones at that point to go, what's going on here? And so I was able to completely reverse it. And then that's when I became a hormone specialist. I just went crazy on the whole perimenopause and menopause and started to go, we are not being told the right information, or any information for that matter. And we're all turning to our medical doctors for information when less than 7% of doctors are even trained in menopause. None of them are trained in perimenopause. And so here we are, we're going to our medical providers and they're going, I'm not giving you HRT, or I'm not going to, or, oh, this is natural, or here's your birth control or your hysterectomy. That's what their answers are.
Interesting. All right. So I want to kind of lay a framework here, and hopefully I get this right. There's pre, peri, and postmenopause. Pre is the time from a woman's first period until they enter perimenopause. Perimenopause is the time when period regularity starts to wane. Menopause, as I understand, is the one day, right? That is 12 months since your last period. And then postmenopause is all the time from that period. So one, did I get those definitions right? And second, the key hormone is estrogen. What's going on with estrogen during kind of these time frames?
Yeah. So actually the first hormone to start going is actually progesterone, and it's a key hormone. So there's progesterone, estrogen, testosterone, and then there's a bunch of like the subhormones, or like the not quite as, maybe significant when it comes to this time. But for some women, they'll also lose thyroid, oxytocin, cortisol can get dysregulated. DHEA goes down for everybody. So there's other hormones that are going to kind of come along for the ride for a lot of women. But your main ones that really affect women in the beginning, number one is your progesterone. So when a woman ovulates, which typically is about halfway through the month, that's what makes it so that you produce the bulk of your progesterone. So as we get older, of course, we're not as fertile. We all know this, right? Like you're hitting your late 30s, early 40s, and you're trying to get pregnant. Your doctor's going to tell you you're a geriatric pregnancy because you're literally like your ovaries are getting older. That does, yeah. And yeah, and then you have to get all the tests. It's all freaky. I had my son at 38 and I was considered like high risk. And I'm like, what? How is this possible? But women are waiting. We're all waiting now. And it's like, well, actually, we shouldn't be. Ideally, we should be having babies earlier because we don't ovulate as often till we don't ovulate at all. So what we're seeing now is women are kind of getting to that progesterone loss and ovarian loss earlier and earlier right now. And so average age to start perimenopause is around 38. But it can happen as early as, mid 30s, early 30s. It's kind of more and more. And then, so progesterone, because we're not ovulating as often, it's the first to take a nosedive. And by the time you're in your early 40s, most women will have lost about 75% of their progesterone production. Progesterone, second half of the cycle, when it's supposed to come on board, has an incredible benefits for us. It's going to counterbalance estrogen. So they're yin and yang to each other. Estrogen's a growth hormone. It's by far the most important hormone for us women. It's what makes us women. It gives us breasts. It gives us hips. It helps us have babies. Progesterone is very calming. It'll stop the growth and like counterbalance that growth in the uterus so that when the uterine lining grows, thanks to that estrogen in the first half of the cycle, now progesterone comes in and counterbalances that growth. If progesterone's not there, we get too much growth in the uterine lining. And so women will start getting really, really heavy periods. They'll start to get fibrocystic breasts because progesterone will counterbalance growth of the breasts in the breast tissue. So it's very breast protective. Progesterone acts on what's called the GABA receptors of your brain, which I'm sure your listeners have heard of GABA. It's a very popular supplement for anxiety and sleep. So now we've got, not this nice protective, calming progesterone in the brain. So women will get insomnia. They'll get low-grade anxiety, sometimes high-grade anxiety. And they're like, what is happening? So we're bleeding more. We've got more anxiety. We can't sleep. And so these are the first symptoms of what begins to happen in that perimenopausal phase. And then when we hit about 45 and above, now we start to get haywire estrogen. So we'll have months where estrogen goes high and then estrogen is going to go low until eventually it tapers right off. And that's typically in your late 40s, early 50s, until both your progesterone and your estrogen are next to nothing. And in between this time, testosterone typically starts to take a dip as well. And testosterone is actually a woman's most abundant hormone, which I think most people don't know that. People think of it as the man's hormone, but testosterone, it is made first within the ovary, and then that is converted into estradiol or estrogen. So testosterone, we have way more testosterone than we do estrogen or progesterone in our fertile years. We make about 50% in our ovaries and about 50% in the adrenal system and other conversions in the body from other hormones. So some women, about 50%, will lose a lot of their testosterone through these years, but some women don't lose it. Some women will actually hold on to it. Good adrenal system, good stress management. They may have a better chance of holding on to that testosterone, which is really important for many different things. Obviously sex drive, but also muscle growth, metabolism, bone health, and then estrogen. As we start to lose estrogen, has to do with over 800 functions in our body, which is just like mind-blowing. They don't even know half of it. It just keeps going and going and going. It's not just about fertility. And none of these hormones are. And I think we have to stop calling them even like sex hormones because they're life hormones. These hormones if they have to do with 800 different functions in the body, like we have estrogen receptors on every organ system. So when we start to drop estrogen, so many different aspects of our internal system can be affected, and it's different for every woman. So some women, they can start to develop fatty liver disease. They can start developing insulin resistance because we need estradiol to process blood sugar. Some women start to get chronic urinary infections because we need estrogen to help with bladder and the bacteria that's in our bladder. Some will start getting yeast infections because it affects the vaginal microbiome. It'll affect your gut health, and then it'll affect your brain health, your skin health. Like estradiol helps us to make collagen. So that's why we start to get saggy skin and lots of wrinkles. And in perimenopause, it's like your skin changes overnight because you're losing estrogen. Joint pain, like all these, like some things are like women have no idea that it has to do with the loss of these hormones, because we all just tie our hormones to our cycle. And so if it's affecting our cycle, then it's like, oh, it's hormonal. But if you're not of somebody that's, maybe your periods are fine, but yet you suddenly have depression. Well, estradiol is needed for the production of serotonin, which is our, antidepressant neurotransmitter. Or some woman will get back pain and sudden, like frozen shoulder. Frozen shoulder is caused by the loss of the hormones. Like all of these weird things, bone loss, like it just, the list goes, I can just go on and on about all the different parts of your body that it affect. Like we have estrogen receptors in our eyes, in our ears. So women will start losing eyes. They're not hearing as well. Like it goes on and on.
And I thought that was just a way to manage husbands lose their hearing. So you mentioned testosterone, right? Like managing sex drive, bone growth, muscle. Those are things that just come up. The correlation to longevity, right? And we're a longevity podcast is just such a direct. Kind of direct response, right? You mentioned frozen shoulder, you mentioned bone loss. I had a question of like, what are kind of the general symptoms? You've covered a lot of those. What are some of these like real hidden ones? You're like, oh my God, I would have never thought. And you touched on some of them. Are there any you're like that you actually had to dive in and do even more research and go, oh yeah, that probably is related?
Yeah. So heart palpitations is something that's very common that women don't realize is from the drop of estrogen. Testosterone, interestingly, like I always tell women, testosterone, it does give you it gives you your balls. Like it does, it makes you want to get out there and get shit done and like be aggressive and like get, if you're a businesswoman, it helps you to have that drive to get stuff done in your job and to, climb the corporate ladder or whatever you want to call it. But it does really help us be more kind of towards that stereotypical masculine energy, which is really important for women. It gives, and just energy in general. So a lot of women, their energy drops, and that's because estrogen has to do with mitochondrial function, and then that testosterone can also give us a lot of energy. And so there's some very common things that will happen there that women have no clue that, oh, this could be due to this hormonal loss. A lot of the things can't be seen. So we'll get, I'll have a lot of women come up to me and say, I don't have any symptoms of hormonal loss and perimenopause or menopause. And it's like, yeah, but all three, progesterone, estrogen, testosterone, really important for bones and bone health. And that starts to go very early on and not something that can be felt. And so it's like, yes, you maybe you don't have hot flashes and night sweats, but almost guaranteed you're going to be having bone loss already, even when you're in perimenopause. And so that, the heart, really important. Estrogen's very important for heart function, brain. So, there's been some amazing studies done on estrogen in the brain, but also progesterone. Progesterone helps protect the myelin sheaths in the brain. Estradiol, there was a great study done out of Arizona in 2021, I think it was, on 400,000 women that showed that women that replaced estradiol for 6 years or longer had a 78% lower chance of developing Alzheimer's and dementia. Like that's crazy number. Number. So, and cancer, like it even showed in so much of the research, like the WHI study, and there's been other ones on large amounts of women that showed that women that replaced their hormones had over 30% reduction in all cancers. And so it's like, wow, what supplement, you're talking about longevity, what supplement, what biohack, what device can reduce your risk of cancer and also all causes of mortality it was like 32% all cause mortality drop. Like What do we know of that can give you that much of a boost of longevity? Nothing. There isn't anything that can reduce your risk of all causes of death by over 30%. And so there's so many hidden things that you have no idea are happening on the inside from that hormonal loss.
Yeah, well, one, sauna, right? Like just to like sauna has, the Finnish study, whatever, it's 3 times a week, maybe it's 4 times a week, shows kind of a 40% decline in all-cause mortality. But you're talking right, and you know how crazy this is, right? I'm doing the research for this interview. I feel like I got everything buttoned up. Literally today, I'm listening to an audiobook, which you would not think is going to have any relevance to this conversation. What the Dog Says by Malcolm Gladwell. So if you know Malcolm Gladwell, he wrote The Tipping Point. He's an amazing economist, sociologist, a writer. And he talks about the history of the pill. And that the pill was born and has a 28-day cycle because actually for religious reasons, to appease his particular religion, the kind of inventor, and then goes into, the number of periods that Western women have is not a normal amount of periods, right? They went to a very particular tribe, they're counting the periods, and because they tend to be pregnant or nursing, so they're not actually getting their cycle, that we actually have a lot more periods in Western culture than not. And then they start digging into the data, and there's this significant improvement in cancers. Breast cancer, I think, was very, very particularly mentioned. And so like the whole paradigm, I don't know if you've heard of any of this. I was going to kind of save it for later, but you're talking right in line with this. I think it's a phenomenal thing. Have you heard about this and kind of followed that piece?
I know a lot about the birth control and just like the effects of it and on our system and how it's way over abused. And it's the one that's the most toxic out of when we're talking about hormones and hormone replacement therapy. And people classify them as hormones, which they're not. They're actual hormone disruptors. But they destroy the gut microbiome. They can shrink parts of your brain. We are not being told the truth about birth control pills.
Hey, super quick break from the podcast. Hopefully you're loving it. This is a way you can support the podcast and take advantage of a great offer. We're offering 50% off of one of our MCT bottles. MCT is an amazing oil. Add the ESS 60 molecule to it. It's even more amazing. All you got to do is leave a review on iTunes. Send us a notification that you've left that review. We'll get you a coupon code that'll get you 50% off of our MCT oil and free shipping. Back to the podcast.
So that's a whole nother side to this same kind of conversation, right?
Yeah.
You're like, how am I going to handle this? Great. Like, this is why we do, like you and I do podcasts and have these types of conversations. So that would be interesting to dig further into, to understand. I mean, a premise of his is if you're going to be on birth control, there's the only reason that there's an actual cycle that they actually introduce a period because they have control over it with those
which is a fake period. It's a faux period.
Right, is the only reason they do that is to mimic the cycle, and they actually don't need to do that, and there are some benefits in that regard, theoretically. I have a lot more to dig into, but just crazy how I'm listening to what the dog says and have something to add to the conversation today. All right, so you've covered, progesterone, estrogen, testosterone, all the supporting hormones, and the first thing that somebody, probably a male doctor, was like, we should just replace these, right? Like we can fix this. Nothing ever works the first time. Is there any sort of history of like, we tried this, it didn't work, or we overshot, and like, how has hormone replacement therapy, and then we'll get into like how it's controversial, but like, how has it kind of evolved over time, and how wrong did they get it in the beginning? Because I'm sure they did some stuff wrong.
They definitely did, yeah. Well, I shouldn't say that because the research still shows, interestingly, that even old HRT is better than a woman not taking any HRT, which I thought was interesting. So in the 1950s, the first kind of HRT came on the market, which was Premarin, and that was derived from pregnant horses' urine. And it first came from humans, but they realized that was too expensive. It was from pregnant women's urine, and that was too expensive. So then they got it from horses. And as you may guess, we are nothing like a horse on the inside. So their estrogen is very different than ours. It has many different types of estrogen that we don't have. But it worked and it was cheap. And so they made Premarin for women. And it was so amazing. It was so amazing that by the late 1900s, it was the number one most prescribed medication in North America.
Wow.
So out of all medications, Premarin was the one that was given the most. So you can imagine how many women were on it if that was the case. And it was just that it was very common. It was, it was like, you're going into menopause, here's your Premarin, basically. And they brought in another drug that was a synthetic progesterone to protect the uterine lining. And it was called Provera. So they had this combination of Premarin and Provera called Prempro for women with a uterus. And they were super happy with it. All these women were on it. And they decided at that point, and also at that time, they would use high doses of estrogen to treat breast cancer, which I think is also very interesting. Anyways, by 1992, they decided to do the Women's Health Initiative, one of the biggest studies of its kind, to set out to prove the benefits of HRT on cardiovascular disease. And during that time, so they started it, they had two main groups that were taking the hormones. One, the women had no uterus and they were on just Premarin. And then they had the other group on Premarin and the Provera. So they had the combination progestin and the horse's estrogen, basically. So several years into it, they actually stopped the study because they saw an increased risk in breast cancer. And later they saw an increased risk in cardiovascular problems. And so they actually halted the study, sent out to the world, oh my gosh, hormone replacement therapy causes breast cancer and heart attack and stroke. Get these women off their HRT. And it was literally like overnight, Chris, that it was like 75% of HRT users, that's how much it dropped, right? 75% around the world. Like a huge amount. And we have yet to recover from that. And the truth of that research was, and the actual people that did this study have now come out to say, oh, by the way, basically, like, it was
hey, one footnote.
Whoops. Yeah, just FYI. It was the arm of the study where the women were on the combination of progestin with the Premarin that had the increased risk. And even that was a very minuscule. It was like one extra woman out of every 1,000 that developed breast cancer. Rather, the women that were in this arm of the study that were only on the Premarin, that had no uterus, had a decrease in breast cancer rates by 24%. And this has been shown again and again from that study. But yet nobody's hearing about it. Doctors certainly have not done their research, because every single day I have my clients and patients that are telling me, oh, I went to my doctor and they refused me HRT and flat out said it will give me breast cancer. Every day I hear this. And so it is, and you can talk to any woman, and if you say to them, why don't you go on hormone replacement therapy? They'll say, well, it gives you breast cancer. Or they don't know why they fear it, but they're like, oh, no, I'm not going to do HRT. And it's like, and they like protect their like, oh no, can't do that, because they all think,
Like, no,
even
no.
if they don't know why, they all think it's going to give them cancer. And that's because of the Women's Health Initiative. And since then, it's very interesting because the long-term studies show that women that were on Premarin for, 10 years or whatever, they actually have less chance even of dying from breast cancer if they did end up getting it because they took the estrogen replacement therapy. So it's got this long-term effect on breast protection, not breast cancer. Like it's crazy. And not to say there are types of cancer that estrogen will drive that because it's a growth hormone. And so if you've got breast cancer cells, well, our breasts are full of estrogen receptors, that estrogen can go there and make it proliferate. And so there is a tie to it, for sure. And we see that things like tamoxifen and other estrogen blockers can be helpful in women that have had breast cancer to block the estrogen and things like that. But there's new evidence showing that there's a lot of women, depending on what type of cancer they had, where they're using estrogen bioidentical, not horse's estrogen, bioidentical estrogen replacement therapy post breast cancer. And they're seeing that it's leading to less reoccurrence of breast cancer. So it's like, we've got this all wrong. And we're not being told, like, no doctor's going, oh, well, we better watch your estrogen levels while you're here in menopause because it can help protect your breasts. We don't hear that. We hear it's going to give you breast cancer.
It sounds like you have the estrogen. There's maybe the estrogen breast pyramid and the food pyramid, because I believe they recently flipped the food pyramid upside down. So this is another pyramid that needs to be flipped upside down.
Upside down.
So
yes,
to go
like
from
that.
You said like the 1900s, the most prescribed medication on the planet, or that may be, that's probably accurate. And then just this study comes out. It's got, they don't share the nuance. I mean, we struggle with nuance. People are going to claim, even today, where everybody could go out and read the paper. People aren't going to do that. They're going to grab onto the piece that they want. But back then, what came out of the news was fact and rote, and like there were no doubts. And so it chops it in half, and it's actually not beneficial. That sounds like our medical system. I guess that's
crazy that our medical system would do this.
No, I do not really fit in the corner of conspiracy theories. Certainly, there's we can say things like banning peptides feels like big pharma, whether you fall in. Do you have any sort of map of conspiracy of like, why did this really come out? I'm sure there's got to be something out there.
I haven't with that particular. I mean, I have other conspiracy theories about other things, but when it comes to hormone replacement therapy, I mean, you can imagine the pharmaceutical company was benefiting from it being so popular, and their sales plummeted afterwards, which if you want to go down the conspiracy road, maybe you would say, well, now women are having this onslaught of serious health conditions because of the loss of the hormones. Sometimes, not always, but it's certainly contributing to all of these causes of death, like heart disease, right? It's our number one cause of death. When we know estrogen replacement therapy can help prevent that and can help prevent insulin resistance and metabolic issues and osteoporosis. And so depression, anxiety. So what's the alternative? These doctors are like, here's all these prescriptions, right? Here's your birth control. Here's your bone meds. Here's your heart meds. Here's your statins. Here's your antidepressant. Here's your anti-anxiety. So maybe they're benefiting more off of all of the medications that they're now able to prescribe because women are refusing to take hormones or not being told they can take hormones. So there's the conspiracy.
I really appreciate you digging and trying to manifest a conspiracy.
Some conspiracy.
I appreciate your digging into that. Tomorrow it's going to be all over the internet because that's just how things work. So there is a mindset, at least one mindset, right? That menopause is a natural condition and maybe we shouldn't be messing around with that. And then I also kind of wrote down, I think we're looking at the symptoms and trying to address the symptoms. Is there, would we ever have the goal of, hey, we just want to have access to our cycle in perpetuity? Is it what might be, is there an optimal balance? I'm not even exactly sure what I'm asking, but you might have, well, you just dug a great conspiracy theory out of thin air. So let me know if you need some more clarification.
No, because I that's probably the biggest comeback or whatever. Like when I go and I speak at these conferences, it's always, and almost every podcast interview, or if I'm doing a Q&A for somebody's group or something, it's the number one question asked, which is, but isn't this natural? Should we not be going through menopause? And there's a few different thoughts behind that. One is, look at everything that we're doing nowadays, Chris, that to help prevent aging. Like, look at the supplements, the amount of supplements. And yes, a hormone is not a supplement, but nowadays we have the choice of taking bioidentical hormones, which is exactly how our body makes it. It's not coming from horses. I mean, you can still get access to that, but in general, we're using bioidentical hormones, which is the exact same makeup as our own. And as I said before, there's no amount of supplements, there's no amount of biohacking that will bring those hormones back or get rid of those issues that come with hormonal loss for some women, right? So what's the alternative? The alternative is, oh, I don't want the hormones. It's not natural. It's natural for me to go through menopause. Yes, it's natural for every single one of us to age, is what you're saying. It's natural to age. 100%. So let me ask the person that says, I'm not taking HRT because it's not natural. Okay, when you get heart disease at 70, just simply because you're old, and this is the number one cause of death for men and women, so chances are you may get it. Are you going to tell your doctor when your doctor says, hey, Chris, you get this medication and it's going to help save your heart and it's going to help you to live longer? Are you going to say, oh, no, thank you. This is normal. This is natural for me to age. So I am not going to take that medication. I'm not going to have the heart surgery. You would never say that. Ever.
Yeah.
No. It's kind of like, what's the alternative? So we have this bioidentical hormone that, yeah, we are supposed to lose our hormones. We are supposed to age. We are supposed to die. We're supposed to get old and wrinkly, and our vaginas are supposed to dry up, and our bones are supposed to get brittle. Yeah, we're supposed to have all of these things happen because of the hormonal loss. Do you want that to happen though? Or do you want to live optimally, and do you want to live feeling your best and looking your best and warding off all of the medications that could be coming down the pipeline? Yes, we want to do everything we can to optimize our health. And so the great thing about hormones is it doesn't come with all these other side effects that all these other medications come with, or you're not going to have to go through all this suffering. So it's like, yeah, hormones are optional, but suffering, do you really want to suffer? I don't know. Like, to me, it's just like, it's a no-brainer. I'm like, I want to optimize my health and do the best thing I possibly can to live my best life in the second half of my life. I don't want to get old. I don't want to lose my sex drive. I don't want to break bones easily. I don't want to get old and wrinkly. And, I know I will eventually, but if I could be doing something that's really natural to my body, I'm going to choose that road for sure.
Well, I think, we may be even entering an era where I could do things that aren't as natural to my body. And if it's proven to deliver benefits, then I'll probably go down that path. I don't want to belabor this, but is there any kind of health reason that if we could keep a cycle with a woman their entire existence, do we have a sense that would be a good thing or a bad thing? For myself, I think it would be a good thing.
Yeah,
to have that.
Because that means I'm
cycle.
holding on to my hormones. Yeah. And we used to die, Chris. Like our natural age of death back in the day was between 45 and 50 when you were hitting menopause. So we're living longer than we've ever lived. We're not living in a normal, natural environment. There's nothing freaking natural about this. And so it's just, to me, it's like, why not give my body back what it had? Like, I don't want to die early. I don't want to shrivel up early. I want to keep optimized as long as possible. And if that means taking hormones, because that's the most effective way for me to do that, I'm going to do it. But that said, it's still, it's optional. This is something that isn't for every woman. And if that's what they choose, great. I 100% support that. Just educate yourself on both sides of it, because we get a lot of women that are like, I'm not going to take that. That's not normal. That's not, and it's like, that can't be good for us. And it's like, just go look at the research. It's solid and it shows, like I said before, I mean, you're going to have less death, we're all going to die, but it can help on so many different levels. And so I just think, educate yourself on both sides of the coin if that's what you think you're going to do, because you owe yourself that much. We want to live well. And so let's learn about all the things that we can be doing to live our best life. So
you coach women, you help them, with hormones and weight loss challenges. Clearly you're a BHRT, so a bioidentical hormone replacement therapy proponent. I'm interested, like, what percentage of your clients are not interested? They're like, I'm not going to do that. And then what do you try to address? Maybe they're not the right customer for you, or what would your approach be if they just said, no, that's not for me?
I do have, like, in our groups and everything that we'd have, and we will 100% support a woman if she doesn't want to take hormones. I don't know if we've really ever had anybody that have just joined or has worked with us, because
or maybe they said no at first, and then you know what? I see this group. I see enough people having positive benefits. Yeah,
exactly. But I typically don't get a lot of women that aren't interested in that, because they hear me talk about it so much, and I'm I really try to educate the masses about them. But if a woman can't take them, for instance, or just because of medical issues, cancer, whatever, or is choosing not to, then I will do everything that I can to help them to feel their best, right? So that can be supplementation. So we can take things like phytoestrogens, which I think is really funny. So women will take like black cohosh, sage, dong quai. All of these things are natural herbals that help reduce the symptoms of like hot flashes and night sweats, basically. Like, that's what you're going to get from that. But what's funny is bioidentical hormones are derived from plants. So it comes from soy and yams. All the testosterone, estrogen, progesterone, it's coming from a plant source. So, when you start to trace it back, it's like, okay, we're okay to take a supplement, but we're not okay to take the hormone, which it's synthetic. Like, you have to take this naturally occurring chemical out of the plant, and then they make it in a lab, but still it's coming from Mother Nature, which I think is pretty cool. So if a woman comes to me with that, there are so many things that you can still do that could help with some of the symptoms. And so different things for different symptoms. You would have to really, like, hormones are like, take the hormone and suddenly all of these symptoms can go away for a woman. And that can be all those things that we talked about. Like, they can get, brain clarity, the depression goes away, the anxiety, they're sleeping better, they feel better, their libido's back, their vagina health gets back, everything starts to get better. Rather the herbal route or the lifestyle hacks, it's more like, okay, well, if you've got some vaginal issues, well, you could take hyaluronic acid that's meant for the vagina, and there's different things for that. Or, for topical skincare, you could do peptides. If you've got, bone issues, well, you make sure your minerals are up to date, up to good levels in the body. And so there's different things for all of the different symptoms that you could take depending on what you're experiencing.
Okay. So, you have one of your certificates is in gut biome. How do you see the gut biome fitting into all of this, and how much do you lean on that when you're providing guidance?
Well, we have kind of like, how you're talking about the pyramid. We do have our own pyramid in our practice where we have to have these foundational pieces in place. And one of them is gut health, because your gut is going to process these hormones. And specifically estrogen is so like, you need very specific gut microbiome. And if you don't have it, or you got too much of a certain type, called beta-glucuronidase, then you're going to recirculate a lot of this estrogen rather than getting rid of it and getting it out of your body. And so gut health is really, really important, especially if you're thinking about doing hormone replacement therapy, because you want your body to be able to metabolize these hormones properly. And a lot of women, even in their fertile years, if they've got gut problems, could have problems with their hormones from those gut problems. And so they're very tied in together. And so we need to make sure, and also estrogen, of course, it is important for gut microbiome. So your gut microbiome starts to shift as you start going into perimenopause and menopause. And so we have to be minding our gut. So we do have like we try and be really open with, every person needs a different kind of diet. And, there's proof that every diet out there works. What we have found is that, as women are going through this time, because their gut microbiome starts to become affected, it is better to go with that like higher animal protein, lower on the grains, lower on the inflammatory foods that can cause gut problems. Some women have to go dairy-free, gluten-free, grain-free. So you have to, we see that working well for the masses, but there's some women that are like, they choose to be vegan or, for whatever reasons. And we try and support that as well. But we still will have the same premise, which is you've got to increase your protein. You've got to, watch your gut microbiome. You've got to still, manage it with whether it's probiotics or I actually have somebody coming on my show soon to talk about a probiotic that is specifically helps with the neurotransmitters in the brain. And I was listening to this woman talk. I can't remember what her name is right now, but because when we're going into menopause, our gut microbiome starts to shift and it can affect your mood, basically. And so she has this product where it helps to repopulate your gut with these very specific strains that can help with the mood changes that come in midlife. So I think it's all the guts, and of course, as you know, influences everything in your body, and including your hormones.
Yeah, I'm really excited, right? Because there is this understanding that your gut biome changes as you age. Why? Like why is that happening? Like what's driving that?
Partially,
and
the
then there's some
hormonal loss.
amazing, right? And then there's these amazing kind of fecal transplant studies where you can take a mouse with Alzheimer's and get rid of it because you did a fecal transplant from a mouse without Alzheimer's, and the reverse is also true. Like there's some amazing things going on here that are I think are going to be really huge. Do you do kind of gut microbiome testing and then also look at it after they've gotten on the BHRTs?
We don't. We can, but we typically don't see a lot of women wanting to do gut testing, unfortunately.
Interesting.
Because it starts to stack up, right? Like if you're going to see somebody privately for hormone care, and many of you know it's expensive, right? To see a functional practitioner, our nurse practitioner, like we've got doctors on our staff, we've got nurse practitioners. It's not cheap to see them.
Yeah.
And so if you're already paying hundreds of dollars for your appointment, a lot of women will choose to do their Dutch test, which is the urine metabolite test, which we really like to see because that's going to tell us how is your body detoxing your hormones? How are you processing everything? Plus what your levels are of free hormones. It gives us a good idea of that. So that in and of itself is $500. A good gut microbiome test is $500. So now you're looking at, okay, there's $1,500 right out of the gate. That's not even including your serum labs. Serum labs are another $250. So now so it just starts to go up. And so it's kind of what we do in our practice is if somebody's got severe gut problems, we can typically address them without having to do the testing.
Get rid of grains, get rid of dairy, maybe try I love the idea of AIP, right? The autoimmune protocol to identify what's actually bothering them. And that's free.
Absolutely.
Like it might be
it's
irritating.
All free. And and supplements are like very similar supplements for things like small intestinal bacteria overgrowth, candida, parasites. A lot of those they cross over. So you give somebody an antimicrobial, help to kill off some of these pathogens, get things moving, get so that their bowels are moving, they're pooping every day. Do we change their diet? And most of the time, that's what helps us to be very successful with getting rid of the gut problems, and so that they don't actually have to test. Now, if somebody's just got chronic, severe, nothing, and none of that's working, then I would say, okay, maybe go do a GI map, or if I think it's small intestinal bacterial overgrowth, go do that, to test. You can test for H. pylori by itself. So we can then go, okay, maybe you do need gut. But I can tell you, Chris, I can't even remember the last time we had to do that. We just haven't had to. So I would rather them spend the money on things that we can't tell by symptoms, or, that we don't want to guess about, which is like, how are you metabolizing these hormones? We don't know until we see it in those tests. And so I'll lean towards those tests before I lean towards a gut test.
Makes perfect sense. Like, you got to be efficient with the dollars, because it's not unlimited funds to tackle the challenges that they're having.
Yeah.
So you know a lot about biohacking and the protocols. You probably go to events. We'll probably bump into each other at events here in the future. But I wanted to know, what's your kind of favorite biohack or biohack protocol or whatever that you would love to throw at clients, and maybe it's just too expensive or whatever, and that you like in general, and that fits inside of some of the budgets.
In sense of gadgets
so
and stuff?
So for your patient, right? Is there any biohacking thing you're like, this is really expensive, but it would probably help a lot? Or, what might be on your list of this would be nice one day?
Okay, so I do have my favorites. And because of my podcast, I get a lot of things sent to me. So I've got so many of the gadgets.
All the things. Yeah.
I got all the things. So I've tried so many different little, biohacks. The most expensive, I would say, would be my sauna that I just absolutely love. I did get a sunlight and sauna, and I think it's so great, and the health benefits are so great. Like you just said, the Finnish study, I didn't actually know that one. So, but I do know that it's so great for you.
Yeah.
Yeah. Like detoxification, right? Yeah, because it's gentle detoxification, and we're so riddled with toxins and hormone disrupting toxins. And so that's another one of our foundational pieces besides the gut is detox. We want women to be regularly detoxing. And if that means through a sauna or a sauna blanket or taking certain supplements, or, there's many different ways you can detox, but sauna is definitely, it's going to boost your system as well as get rid of these toxins, which is great. So that would be the high ticket one. And then I've got a couple I just got myself a Align PEMF mat, the PEMF mat. Do you use one?
No, I've used one at a couple of the events, and it's on my radar, but no, not regularly. Yeah,
so I'm very new to it. I only got it 2 weeks ago, but I got the Align one, which is so cool. It's got actual crystals in the mat, each one has to do with a different chakra in the body. And so every night I've been lying on it, and I just love it. It heats up. It's got infrared, so it heats up. It's also expensive, but it's so detailed. But they're like $2,000. The sauna's $10,000. So these are not cheap. So you do have to kind of decide for yourself, I think, what's most important. And for me right now, my stress is always out of control. Because I'm a high functioning businesswoman running a huge company. So I don't do well with like, oh, let's go take a time out. And these mats really help to ground you and relax you. And you do feel that. Like I do feel like it completely relaxes my system and grounds me. So that would be that's just very quickly becoming one of my favorites. Let's see, what else do I have? I've got so many different things, Chris.
Breath work, meditation?
I do the 4-7-8 breath, and that's my favorite. That's so fast to do.
It's fast.
It's fast. Doesn't take much because I can't meditate. I've been doing the 4-7-8 breath for 10 years, and it's definitely a go-to for anxiety and for stress reduction. And it's something that I recommend for all of the ladies to do that follow me and are in my groups and stuff, because I feel like it's extremely, extremely effective. All breath work to me, it's just like, I love it.
Is that 4 cycles of the 4-7-8?
I do 4. You're not supposed to do a ton of them. Like I think you start with 4 rounds and then you can work your way up. And so depending how stressed I am.
And ironically, on some days, high stress, I do more because I need it, and others I do less because I don't have time. So those are kind of my favorite, like, the breath is nice and that's free. So there you go. That one's a good one. A quick one for skin that I just actually created my own product line. So I'll plug myself here, but cool. I've been doing this for, oh my gosh, so I'm 48. Since about 42, my skin started changing when I started going into menopause. And I always had great skin. And so it really ticked me off. And I started to get really enlarged pores, which I had never had before in my life. And I was just horrified. And so, of course, I did what I usually do and went down the rabbit hole of why is this happening to my skin? And it's the estrogen loss. And there was a great study done where they had women use topical estrogen on their face, combination of estradiol with estriol, which is one of our estrogens. And within 6 months, there was a 60 to 100% pore reduction size. Like a size in their pores. Did I say that right? No. Wow.
A reduction in pore size. Flip that around. And it also showed that it shrunk the depth of the wrinkles and helped to build a certain type of collagen in the face. And so I was like, okay, I'm going to give this a try because it's cheap. And I'm like, great, I can find it online. Started using it and it did exactly that. Like, I swear to God, it shrunk all the pores. You can't see any pores on my face anymore. And I've been using it since. And then so this year I actually came out with my own just over the counter estrogen face cream as well, with a progesterone cream, because you always want to use progesterone with estrogen. And so it's becoming very, very popular. It's very inexpensive as far as like anti-wrinkle face creams go. I do use it in conjunction with my very extensive Young Goose that I have, that's how you and I met, was through Amite, owner of Young Goose, I love him dearly. Anyways, I love his product. I really do. So I use it in combination with that, but some women can't afford Young Goose. So that is one of the best, cheapest skin biohacks for midlife women. And I don't care if you get it from me or not. Like I'm pumping myself up here, but honestly, if you can get it elsewhere, go ahead. But it really does work.
Very cool. All right. So we have covered so much amazing information. I do have some wrap-up questions for you.
Okay.
So we can do this rapid fire because we're a good time in here. I'm glad we got all this information in. Do you have a target age that you want to live to?
No. I'm not.
How long do you think
I just want to live well.
Live well. I like that. Now, do you, in your mind, living well, you think you'll get to?
I think like late 90s.
Okay.
I think I would be okay. As long as I was feeling well, then I'm good with that.
And do you have, how long do you think humans can live?
I'm not a Dave Asprey person that thinks, oh, let's live to 125 or we're going to live to... I don't think we're there yet. I think we'll get there. Definitely. I think we're going to start getting longer and longer lives. But the way things are going now, it's getting less. It's not getting more.
It feels, it's going the wrong way.
It's going the wrong way, and we're becoming more and more sick as a population. So right now, I'm not seeing that this is going to happen, but it's going to. Like, there's so many things coming out now that are extending life. So I do think it's going to, I think it's going to get better, where we're going to start living to 120, 130. It'll keep going. It has to.
Okay. What are 2 to 3 protocols, habits, mindsets, let's call them shortcuts, mostly because everyone likes shortcuts, to longevity and a long health span that you can share?
Replace your hormones. Build muscle. It's like so key for longevity. I mean, you just can't beat it for weight, for everything. You've got to build muscle. You've got to lift heavy. Probably prioritize protein, I would have to say. Like, I'm pretty big on that. Yeah. Because it does so much and we become, we start getting sarcopenia and all these things. So I just think for like longevity and easy biohack protocol, if you could get those things down, I think it's pretty important.
Yeah,
if you do nothing else, like those things.
I was going to say, building muscle is really 2 components, which is the resistance training and enough protein.
Yeah.
But it's important enough to you that it's 2 separate line items. I think that's great. What are 1 to 2 things people get absolutely wrong regarding longevity and a long health span?
Oh, geez. I mean, I saw you gave me this question beforehand, and I should have thought about it, because I was like, yeah, that'll be easy to answer. But now that it's actually proposed, I'm like, I don't know.
If you're like me, you're hoping that your mind will work on it while we're going through the interview, and then it'll just manifest as soon as the question gets asked. So maybe
I think I know what it is. We're if people get wrong is that they are dogmatic about certain things, like diet, for instance. Like, it's like this way or the highway. Like, either you're carnivore or you're doing it wrong, or you're keto, and people get so angry and so these things I've seen online and what people even will come at me with the hormone replacement therapy. And it's like, you guys, everyone's got to stop the dogmatic approach to health and wellness. Like, it's gotta go. Something's going to work for every person, and you have to be open-minded to that. Whether or not you agree with it, who cares? It's for that person, it's working. So don't worry. Don't get angry. Like, no, there's no need for that. For the harshness and the anger that comes with it. It's up there with religion, for heaven's sakes, and politics. It's now we got diets, and that you should be doing this and you shouldn't be doing that. And it's like, no, you guys, everybody's an individual. And that's where people are going wrong, is they're not seeing that every one of us is an individual and is going to need something different.
You got another one, or?
Nope, that's it.
I think that's pretty powerful. Yeah, I think we could just say, stop being angry.
Yeah, stop being angry. Stop being assholes, people.
Yeah, whether it's your biohacking protocol, whether it's your dietary protocol, like, just stop being so angry. And
yes.
I mean, it's not even good for you, let alone good for the people around you. All right, Karen, how can people contact you?
KarenMartel.com. Karen Martel Hormones on social media. I got a very active Instagram, lots of information coming out every single day. Podcast is the Hormone Solution Podcast. My line of hormone creams that are over the counter, KarenMartel.com/shop. And for your listeners, there's a coupon customer10, and that'll get you 10% off your purchase. And I think, yeah, that's it.
All right. What in the near future are you excited about?
I think we're like I'm really excited about my line of products because this isn't something that's easily available to women, and I want to make it I want hormone therapy to be accessible to everyone that wants it. And this is allowing that because you can purchase them online. We always say, please, if you can, work with a physician, work with a doctor, a hormone coach, a menopause coach, because they're tricky and you really do want help if you can. We've got group coaching that's very affordable for everybody. So if that's all you can do, great. But getting help obviously is, I really do encourage people to do that. But I'm excited that I'm able to make this available to the masses. We can prescribe in every state, so we have prescription hormones as well. But to have it available over the counter has been just life-saving for some women. I just had a woman reach out to me yesterday and she was like, my doctor completely shut me down, refused to give me hormones. She said, I've been on your creams for a month. She's like, I've lost 10 pounds. I feel so much better. The pain in my body's gone. She just went on and I was like, whoa, I'm like, can I use this? This is amazing. But that makes me so happy. So that's what I'm super excited about because this is very new for me.
That's awesome. All right. You can reach her at KarenMartel.com. On IG, it's Karen Martel Hormones. Hormones.
Yeah.
And I think if you just got on IG and search Karen Martel, she would come up very readily. She has a new skin lotion that you should go out and try. Karen, thank you so much for joining us today.
Well, thank you for having me, Chris. It's been a pleasure.
I hope you enjoyed this episode of the Live Beyond the Norms podcast. Make sure to subscribe and follow. Also, make sure not to be that guy, the guy sharing this podcast with people who are not interested in living beyond the norms. If you would like to learn more about the ESS60 molecule, the molecule responsible for the single longest longevity experimental result on mammals in history, a full 90% extension of life, visit myvitalc.com. That's myvitalc as in carbon.com.